ECG would be ECG. So it's kind of similar, but it's actually different. So am I supposed to say the acronym in English or in my own language?
Okay, so you are repeating the acronym as it is in English first before you do
In
any
English.
interpretation.
All right, all right. So first the acronym in English and then the
Then
interpretation to my
exactly,
language.
exactly.
Okay, okay, perfect. Thank you.
Okay. Any other questions, guys? You can just raise your hand. Rima, do you have a question? Or you're just raising your hand from previously? All good. Great. Thank you. Pragna.
Hi. So in our language, when we say this, actually it kind of a explanation rather than having a definition. So would that be okay? Because the wording would be changed to explain them what is the meaning of this thing. Is that okay to do so? Like giving explanation what the other main our client want to say to the Ali.
What do you mean by giving explanation that is different from what the client wants to say?
So like
Pragna,
you
please
say,
just stop using things while you're talking because we're having a lot of background noise. I'm sorry.
is
Okay.
that okay? Is it
Give me an
is that
example.
okay now?
That's okay. Thank you so much. Just give me an example to what you want to ask about. So you
Uh,
said that,
like this one EKG.
okay,
So that would be the electric recording of
the
brain,
heart,
right?
the heart. Cardio means the heart.
EKG, EKG, or not ECG. I'm talking about
AKG.
yeah,
Uh, uh, E.
ECG. Okay, electrocardiogram.
The electroencephalogram is EEG.
Oh yeah,
ECG or EKG is electrocardiogram.
cardiogram. Yeah.
Mhm.
So it would
Okay.
be the same in if I would be explaining to Gujarati person. So Gujarati person would know as it is like ECG is a ECG. There wouldn't be any explanation. So
Mm.
those kind of word which for them English or the acronym name would be the same. They wouldn't have any explanation. So do I have to even though give them a definition or not?
Okay. So in your country, do
Hmm.
you say it the same way, ECG? I'm going to go right now and have an ECG done. Is that how
Yes.
you say it in Gujarati? Then this is the way that you should say it.
Okay, so they say
But
just a ECG. There is no other explanation or what. It's
yes,
a ECG.
there.
Okay.
Yep, exactly. However, if you are doing that in your country because you have the knowledge of the English language,
Mm-hmm.
and this is like something that you got from colonization or something like that, then it's not acceptable. Why? Because you are using ACG, you, Pragna, you're using
Yeah.
it because you know English. But if any uh, any other Gujarati person
Mm-hmm.
who doesn't know the English language, who doesn't have the knowledge, they are using something different, then you should use the thing that they are using.
Okay.
If you understand what I mean. Again, I should first, I should first use the
Mm.
local word, the word that we use in our language. The priority goes to the equivalent in your language, whether you are using it or not, whether
Okay.
Gujaratis understand this word or not, or it's outdated. If it's outdated, I don't matter. Please use it. If they tell you what is that, if they don't know the Gujarati word for ECG or AKG, then you use the English word or the English meaning that you're using.
Okay.
Right?
Yeah.
Guys, this is for all of you guys. Again, priority goes to what I have in my language. Doesn't matter if we use it or not. Doesn't matter if it's like an outdated word. and we don't use it. We usually use the English word, but to a normal person or a person who's not educated wouldn't understand it, wouldn't know it because they don't know the English language. They usually use the other namings that they might know, which is the what you have in your own language, whatever that word is. So priority goes to using that word first. Because again, most of the LEPs are like people who don't know the English language. I don't want to say uneducated, but again, they don't know the English language. They are not highly educated, let's put it that way. So we should, again, use a language that they understand. If they don't understand it and they understand the English word better, then it's fine. Just follow your introduction by the English word. Okay? Any more questions?
Yes,
To
myself.
the other part.
Jessner. Jessner. Jessner has a question.
Yes, dear. Please go ahead. What's the question?
Yes, for example, I'm the interpreter and the doctor is saying to the person who speaks my native language that patient, you're going to tell the patient that you're going to have a EEG, electrocephalogram. In my country, people most of the time refers to these acronyms in English, even though they don't speak English. So I can explain in my own language, in my mother language, to the patient electrocephalogram in my own language. I'm going to explain to the patient is a picture of the brain. Is that correct?
Yes. Again, even if you guys, all of you, educated or uneducated, you all use the English word for whatever. Use the English word as it is, but don't just stop at this point. Give a brief description, a very brief description, as what you just said. It's an imaging or recording of the the electrical activity of the brain in your language. Just don't just stop at the English word and that's it. And you assume that okay, so we all were using the English word, so we know what is that. No, just again give a brief description. If you don't have an equivalent and you already use the English word, give a brief description in your language. What is EKG? What is EEG?
Okay. In my country, there are some people they don't really want to know a lot about the doctor's exam. It's an exam anyway. They just want to know, oh, you're gonna have an exam of the brain. This is what they're gonna do. They're gonna have a picture to see what's going on in there. So in my own language, this is most of the time what they are, what these patients are explained to.
Okay, so what's inside the brain? The electrical activity. That's it. It's not gonna be like a big deal if you add this word.
Okay, thank you.
Yep. Okay. Thank you so much. Any more questions, guys, about this part? Thank you. Okay, so this is regarding acronyms. What are the eponyms? Eponyms are names that are given to things like diseases named after the person who whether first discovered this disease or who was first diagnosed with that disease, like Crohn's disease. Uh, Crohn's disease is named after the person who discovered this disease, Burl B. Crohn. And Parkinson's disease is named after the person who got diagnosed with this condition first, James Parkinson, and so on and so forth. Since we already like asked all the questions, let's go. Let's just take like a very brief 5 minutes break. Okay, 5 minutes and come back because we need to talk more about the note taking and we need to practice, and we don't have much time today. Just 5 minutes, and please come back. Keep muting yourselves. Keep just having the camera off. Leave and come back in 5 minutes.
Okay, thank you. Five
Thank you
minutes,
all.
come back.
Yep. Hello, everyone. I'm back. Sorry for being like 1 minute or 2 minutes late. Are you back? All of you? Hope you're back because I'm going to start talking about note taking. Guys, just confirm that you are back.
I'm back. Just there.
Thank you. Thank you.
I'm back too.
Yes, I'm back.
Amazing. Thank you.
I'm back too.
Thank you, dear.
I'm come back.
I'm back.
Thank you. Great, great. Okay.
I'm here.
Okay. So I guess we're all here, right? Let me start sharing my screen. And I hope it works from the first time. Oh. Hmm. Hmm, hmm, hmm. Hmm. Oh, again. Okay. No, I don't know what's happening with Skype. It's really annoying. It is very annoying. Can you see, guys? Guys, can you see anything? You do.
Yeah, I see the share screen. Yeah, it just
Really?
I saw it. I just saw it. It was working.
You saw note taking?
Yeah, I saw it. Just come back to it.
It just shows me that preview unavailable, so I'm not sure if how you did actually see it.
Yeah, note taking. I see it. Fashion and abbreviate
Okay.
book
Can you
notes.
see that I'm changing
Yeah, yeah,
slate?
yeah. You changing. Yeah. You're doing.
Okay.
Yeah.
Okay, guys, all of you, can you see it?
Yeah,
It-
here.
Okay,
Yeah.
great. If anyone has a problem like seeing the screen, please let me
Can I
know.
see your screen, right?
You see it, all of you?
Yes. Yes, I can see
Whoever
your screen.
has a problem, just raise your hand. Whoever has a
Yes.
problem.
Oh,
Those who
oh,
don't have
okay,
a
ma'am.
problem, great.
Okay, ma'am.
Whoever has a problem, do you have a problem, Gessner? You just said that you saw it.
Yes, I see it. 100%, ma'am. Note taking important. An abbreviation in parentheses.
Okay, just put your hands down then. Okay. Okay, great. So, guys, let's now
Okay.
talk about the note taking. Why is it important? Why can't I just rely on my memory and like just understanding the sentence and give a rendition to the patient? For example, the doctor said, I'm going to prescribe a medication to you and it's going to help you so much with your sleeping problem. Why don't I just memorize this and give a rendition to the patient just like that? First, because your mind will be already actually while you're listening to me, you're not doing anything, you're not taking notes, you're not like going to reply to me, I didn't ask you any questions, you're not expected to repeat what I was saying to you, right? You're just listening to me. While you're just listening to me right now, your mind is already occupied doing several things. While you're just listening to me, your mind is hearing. Okay, so it sends signals to your ears to hear me. and it retains the information that I'm giving you in English according to the knowledge that you have in the English language that is stored at the back of your head. It still like works on that. It retains the information according to the knowledge that you're having, and it interprets what I'm telling you in English to your own language automatically, because English is not our first language. Could be the second, could be the third, but it's not the first language. It's not our mother tongue. So while I'm talking to you in English right now, your mind is occupied doing those three processes or those three things. It hears, it retains the information, and it interprets automatically, even without you thinking about it. So if you give your mind an extra job, which is to memorize the speech, it's going to fail you. It's not going to help you at all. However, and actually before I say however, this is how all human beings are made. So don't think that you have any exceptional kind of like superpowers and your memory is going to help you every time someone speaks to you. Even with the LEP, even with the LEP who speaks your own language, you still need to take notes of what they are saying, because they could give you a lot of information. They could give you names of medications. They could give you like a whole story of their life, maybe. So it always tends with the LP to be a very big sentence. So you have to take notes. You can't rely on your short memory. We're not talking about your memory, okay? But we're talking about the short memory. The short is not going to help you so much with remembering what was said to you like 30 seconds ago, okay? Unless you take notes, you take the proper and the key words of what that person was saying, proper notes, and your short memory is going to help you to fill in the gaps. I was saying, however, so this is the however. This is what we need you to do. This is the however. If you want to reach the 100% accuracy that we were always asking you to actually do or have in your renditions, and this is actually what is expected from you to like give a 100% accurate renditions of what was said, you need to use both your memory and your note-taking skills. So again, you can't 100% rely on just taking notes, and you can't still 100% rely on your short memory, because either way, you're going to fail. You're not going to reach the 100% accuracy. So how this is going to work actually? With the help of the memory and the note-taking skills, again, today I will be sharing with you some methods that's going to help you with the note-taking. The short memory is still needed to help you fill in the gaps. For example, a sentence like, I am going to prescribe 2 medications to you. The first is lisinopril and the second is atorvastatin. Okay? Lisinopril and atorvastatin. Those are the names of medications. And your short memory is not going to help you with remembering names. Guys, there are some keywords that we choose in sentences, and those are the keywords that we're going to have in our notes. Keywords are like names, names of people, names of medications, names of conditions, names in general, names of places, and numbers. Numbers, whatever the number is, a dosage, duration, phone number, an address number, whatever. Numbers and names are keywords. So in a sentence like this, I am going to prescribe 2 medications to you. The first is lisinopril and the second is atorvastatin. It's a very short sentence, okay? So what is the keywords here? The keywords that I'm going to have in my notes are 2 meds, or if you don't want to like put 2, that's fine, because you already have names of medications and your memory is going to help you with this. So just in case, let's say that, okay, I'm an interpreter who's going to do that. 2 meds and atorvastatin and lisinopril. So those are my notes that I'm going to take for a sentence like this. With the help of my short memory, I will be able to give an accurate rendition of this sentence. So the memory is going to help me with I will prescribe, and in my notes I have 2 medications, 2 meds. So I will prescribe 2 meds or 2 medications to help you with your condition. So I will prescribe, and to help you with your condition, this is gonna be retained by the help of my short memory. And the first is atorvastatin, the second is lisinopril. So in a sentence like this is how I did the fusion, the combination of using the short memory and the note-taking skills. This is how I reached the 100% accuracy that I'm looking for. Short-term memory, exactly. Okay, so let me give you some tips, guys. There is no specific method that I'm going to ask you or recommend to you. I'm going to share some methods with you, but I'm not gonna recommend any of those. Why? Because this is an individual thing. It's up to you guys. Whatever works with me best could not necessarily work with you best, right? Or this doesn't mean that it's gonna help you so much with your note taking because it's helping me. Again, this is an individual thing. It will be left up to you. Whatever works with you the best, please adopt this method. Whatever you think you tried and you think that it's not helping that much, then try with another method that's working best with you to save time and to keep up with the pace of the speaker. And there is one more thing that I want to tell you guys about, that a speed of a writer is slower than a speed of a speaker. If you think about it, the speaker speaks a lot in a very short time. Could give you like 4 sentences in like 30 seconds. But in 30 seconds, a writer can just write 1 sentence or 1.5 sentence of what the speaker was saying. So please always consider this fact. A speed of a writer is slower than a speed of a speaker. And that's why you have to select the keywords that you're going to have in your notes. You're not gonna write everything down. We're going to get to that part later, but this is just something that I want you to please always consider. It is very important. It is impossible to write everything down. It is impossible. It is impossible. And I'm repeating this because it is a fact. Okay? So please always consider this fact that you cannot write everything down. You have to select a proper note or proper notes with the keywords in a sentence. And the rest will be left to your short memory, and you have to train your short memory. There are some skills that the interpreter has to have to be able to work and succeed in this field, unfortunately. One of the skills is to take proper notes, to be fast in taking your notes, to select the keywords in a sentence, and to train your short memory, to make sure that you're multitasking. This is also a skill that you have to develop and you work on to multitask, because you will be listening to what the speaker is saying while you are taking your notes. And you're not just taking notes, you are selecting the keywords from what the speaker is saying. And you're focusing on what they are saying, you're understanding the speech. So, because you are required to give 100% accurate rendition of what that person was saying in a different language. You're not just repeating it again as it is in the same language. You're actually going to repeat it to another person who speaks a totally different language. So you have to work on improving your skills, the skills that any interpreter needs, or actually this is a group of skills: to be fast, to train your short memory, to be an active listener, and to select the keywords from the speech. And to focus, of course, multitask. to be able to focus on two things, doing two things at the same time. We're going to be multitasking. What are the methods that we are going to share with you today? We have the abbreviation method, main ideas, grouping, mnemonics, symbols, and or pictures. We're going to talk about those in detail. The first method is abbreviation. What is that? It's more like the acronyms when we talked about the acronyms, if you remember. Abbreviation is just abbreviating a whole word, for like two letters, one letter or something. This is the abbreviation. Instead of like having a whole word written in your notes, you can just abbreviate it for just one letter or two letters. Again, consider that it's impossible to write everything down. And you need to consider the time. You need to consider that, again, a speed of a writer is slower than a speed of a speaker. And this is number one with the time. Number two, you need to consider the flow of the conversation. If you remember when we talked about the protocol, your main responsibility in your call is to control the flow of the conversation. Again, what is the flow of the conversation? The flow of the conversation is someone speaks, the other replies, and then he replies, and then the other person speaks, and so on and so forth. It goes, a normal conversation goes back and forth between two people with a normal pace, right? And there is no much pausing in between. So to keep the smooth flow of the conversation, you have to make sure that you're not causing this pause. You are following the speaker, like 3 seconds after the speaker stops, you should start your indentation. This is the protocol. Maximum 5 seconds. And this is the maximum. And sometimes when clients and LEPs think that you actually like pausing for more than the normal, they're going to ask you, interpreter, where are you? Interpreter, did you hear me? Interpreter, what did he say? Can you please translate? If they do that, if they say that, you fail. You fail in controlling the flow of the conversation, in your main responsibility over the school. Okay? So again, consider that it's impossible to write everything down. Consider that you have 3 seconds only to start your indentation after the speaker stops speaking. Consider again that your speed is slower than the speed of the speaker. So you have to make sure again that you are using the proper method that's going to help you with those points. With the speed, number one. Okay? With the abbreviation, you can create your own, and please use it with the most commonly used words or something. For example, instead of writing down the whole word of diagnosis, I can just put it in my notes as in DX. I abbreviate it for DX. Someone else would like to abbreviate it for DS. It's up to you. It's fine. You can make your own, as we said here, or you can create your own abbreviation of words. Up to you, whatever. However, guys, don't use 2 abbreviations or 3 abbreviations for just one word to avoid confusing yourself. Because it is a common mistake, unfortunately, among interpreters that they use different methods and different abbreviations for words, which confuses them and makes them unable to actually read their own notes. It happens a lot, even with trainees in my sessions, that when we start practicing and they take notes, I ask them to like give me a rendition of that sentence, and they stop in the middle. So I tell them, what's wrong? What happened? They tell me, well, I don't know what is this word. I just had it in my notes and I cannot really read it. This is a common mistake. So again, make sure that you don't confuse yourself, and make sure again that your handwriting is kind of polished, because it also happens when we like write a whole sentence, or I'm sorry, not whole sentence, a whole word, and my handwriting, because I'm trying to be as fast as I can, so I just wrote it in a way or something that made me unable to actually read it. So make sure that your handwriting is read to you, and you don't confuse yourself with especially the acronyms or the abbreviation method, if you use different abbreviations for just one word. Just fix the abbreviation for whatever. If you're going to use DX for diagnosis, then use DX forever. If you're going to use DS, then use DS forever. Don't use DX once and DS another time. Okay? Vital signs, again, VS, treatment, TX, shortness of breath, SOB. If you want to use those, it's up to you. If you want to use any different abbreviation for whatever, it's up to you. You can create your own. The second method is grouping ideas. For example, I have a sentence like this, or a sentence where a doctor is actually telling a patient that they're going to do some tests and they're going to prescribe some medications. So here I have two ideas. The idea of doing a test or doing some tests and the idea of prescribing or having some medications. Two ideas, I can put it in circles, like in this example. This is a true example for notes that an interpreter took for a specific sentence. The sentence was, okay, so let me try to make up a sentence for you guys using this, using the notes that I have here. According to what I have here, okay? And according to what I told you before, that we're going to leave some parts in a sentence for the help of the short memory. So I imagine the sentence was, I am going, or I require you to please do some tests. I need you to do a CBC test, and I also want you to do a urine test and to go to the scanning room to do an ultrasound on your stomach. I'm also going to prescribe some medications to help you until the results come up. I will prescribe you an ibuprofen, Zofran, and a muscle relaxant to help you with the sleeping issue. I imagine that was the sentence. According to the notes that I have here and according to what we said about the short memory, the help of the short memory, I will try as much as I can to give you 100% accurate rendition of the same sentence that I just made up for you guys. I require you to do some tests. I need you to do a CBC test, and I also want you to do a urine test, and I want you to go to the scanning room to do an ultrasound on your stomach. I am going to prescribe some medications to help you with your problems until the results come up. I'm going to prescribe ibuprofen, Zofran, and a muscle relaxant to help you with your sleeping problem. Now, my question to you guys, was it like the same sentence or different? I guess it's the same sentence, right? It was like 100% the same sentence that I said the first time. So this is, again, like a representation or like, again, like a live example, how you are required and how I want you to like use your short memory and your note-taking skills in giving a 100% accurate rendition or 100% accurate interpretation of the sentence. Okay, so this is one. This is the second method. The third method, again, it's grouping ideas, but instead of like having it in circles, you can put it in columns or rows. If it's like more than 2 ideas and I can't like draw 3 circles in my notes, it's going to eat up the space. So I can just put it in rows or columns. Like example like this. So the doctor here or the provider asked about symptoms, medications, and allergies. Okay? So instead of having 3 circles for symptoms, medications, and allergies, I can put it in rows or columns, up to you. In this example, the interpreter used 2 methods. Can anybody tell me what are the 2 methods that the interpreter used in the example that you can see on the screen? You can raise your hand.
Well, apparently they grouped stuff into
Okay.
rows.
Okay.
A row for symptoms, a row for medications, and a row for
Amazing. Yep. So what is the second method?
allergies, I mean. Uh, Second method?
Yep. So the first is grouping ideas. This is the first method that the interpreter used for this example. What is the second method?
Rows?
No, this is not a method. We said the first method is abbreviation, the second is grouping ideas, right? So he basically used two methods here.
Oh, yes.
Abbreviation and grouping
S,
ideas.
yeah, S, M, and A for
Yep,
symptoms,
exactly.
medications, and allergies.
Thank you. Okay, so yes, the interpreter here used two methods. The first method is abbreviation. He abbreviated the word symptoms for S, the word medications for M, and the word allergies for A. And then he grouped the ideas. The first idea is for symptoms and what are the symptoms and so on and so forth. So you can actually use more than one method, right? So you can do whatever to help you with the speed, to keep up with the pace of the speaker, and to help you with controlling the flow of the conversation so you don't pause or you don't make the speakers wait for you until you start your rendition and you are already like helping, again, you're training your short memory to help you with the rest of the sentence. The third method is mnemonics. Mnemonics, again, it's more like the abbreviation, but it's used with a group of words that can be used together. Instead of writing fever, cough, and shortness of breath down in your sentence, in your notes, you can put it as an FCS. Instead of writing down nausea, vomiting, and diarrhea, you can put it as an NVD. And by the way, again, it's the same as abbreviation. Don't change the abbreviation or the mnemonic that you are using for whatever. Fixate it, have it fixed for one thing. So fever, cough, and shortness of breath, this is usually like a combo that providers usually ask about whenever a patient comes and complaining about problem with the lungs or the respiratory system or with their breathing and whatever. And those, again, nausea, vomiting, and diarrhea or combo symptoms that providers usually ask about when patients are suffering from any problem with their stomach or something. Okay. So again, especially abbreviation and mnemonics, please don't change the mnemonic or the abbreviation that you're using for whatever. Pictures and or symbols. This is another method that you can also use. If you think about it, if you like draw pictures or symbols, it will make you, save time more than just writing words. It's faster than writing words if you draw symbols or something, and you can use whatever symbol that you prefer. Like, for example, instead of writing down 2 years ago or 2 days ago or whatever, you can just use an arrow or draw an arrow in your notes and have 2W, 2 weeks ago, 2 days ago, 2 years ago, whatever. Okay? And anybody who's speaking about heat or temperature, anything that's related to heat, you can just put it as in triangle. Someone's talking about a cold, they called yesterday, or someone is going to give them a call, whatever. Instead of writing down the word, you can just put this simple, and that's it. Okay. This is also another method. The last method that we're sharing with you today is SVO. We call it SVO because it refers to subject, verb, and object. This technique is going to help you with, not having to write too much. In a sentence like this, for example, I will leave and come back with your discharge instructions and your flu shot. You just have in your notes SVO already. And what is the subject in this verb? I. What is in this sentence? I. What is the verb? Leave and come back. What is the object? Instructions and flu shot. And with the help of your short memory, you're going to fill in the gaps. What are the gaps here? I. What is the gap? I will leave. I will leave and come back. Come back with what or soon? You said come back soon. Okay, so soon I'm going to remember this. Okay, With what? Come back with what? With your discharge instructions and flu shot. So with the help of my short memory, I'm going to fill in the gaps. I don't have specific rules other than what I told you. If you're going to use mnemonics and abbreviation methods, have it fixated. Always consider that you are a human being. You cannot 100% rely on your memory and don't take notes. And you cannot either rely 100% on your note-taking skills, and you're not just considering that your memory is going to help you with whatever, so you're going to write everything down. We don't do that. It's impossible to write everything down. It is impossible. Please always consider this. So you have to be selective in taking your notes. The keywords, you have to select the keywords, and you have to train your short memory. If you guys are having like any exercises to help with the short memory thing, please do that. You have to polish your skills to be able to succeed as an interpreter. What we need again, we need to be fast in taking our notes. We need to be selective in taking our notes. We need to focus on a speech of a person, to be an active listener. Okay, we need to train our short memory because again we still need it. We're not gonna rely on it, but we still need it. Okay, and we need to make sure that we can multitask, because what we're going to do right now is I'm going to like practice with you. With this exercise, we're going to train our short memory. We're going to work on being an active listeners, and we are going to work on our note-taking skills, being fast and being selective. Okay? So what you need to do is you're going to focus on understanding the sentence while you are taking notes. You are going to multitask. So I'm going to give you 2 minutes. 2 minutes, guys. Please prepare yourselves with a pen and a paper for the exercise that we're going to have. 2 minutes, okay? See you in 2 minutes.
Hey, ma'am, can you hear me?
Yes, dear.
I'm sorry. If we don't have a pen and a paper, like if we just have a phone and the app notes on the phone, can we do it on the app?
You won't be fast taking notes on your phone or your laptop, even your PC. It's always recommended to take your notes with a pen and a paper, because this is faster. If you're a fast typer on a PC or something, that's fine. But again, we have different methods. We have abbreviation and we have drawing pictures and symbols. So how would you do that on a PC or on your mobile phone? If you don't have it for now,
Oh, okay, ma'am.
just
And
practice with us.
can you please give me like 2 minutes so that I can get my pen?
Okay, sure. 2 minutes.
Okay.
Two more.
Okay.
1 more minute. Okay. I'll be
Okay, ma'am.
waiting for
Thank you,
you.
ma'am. Thank you,
Sure.
ma'am. Okay, ma'am. I'm here.
Okay. So, guys, are you all ready? So I'm going to explain again what we're going to do. But I'm not sure if you're all ready. Okay, I'm going to give you one
I'm
more
ready.
minute.
I'm
Thank
ready.
you, listener. Okay, Peterson.
We are ready, ma'am.
Dash, thank you. Who else?
I'm ready.
I'm ready now.
Okay, thank you. Who else?
I'm ready, ma'am.
Ready.
Okay. Who else, guys? Who else is not back? Okay, so I'm going to start. Hold on, where is the practice? So basically, what we're going to do again, I'm going to explain to all of you. We're going to just practice for. Let's see. If you have time, we can practice for 10 more minutes or 15 minutes before we end the session. If you can't stay for 15 more minutes, then I can just give you 2 sentences and that's it. So basically what we're going to do is I will be your client. I will give you a sentence in English or sentences in English, and you are going to take notes, as I just explained. Proper notes, be selective. Again, don't write everything down. Focus on understanding the sentence while you're taking your notes, and make sure you are not doing any additions, omissions, or misinterpretation. Those that we talked about when we were explaining about the protocol. And I'm going to call your names randomly, whoever. As soon as you hear your name, unmute yourself and do a rendition of this sentence. Meaning, tell me the sentence, what it was exactly according to your notes, okay? And again, make sure that you're not omitting any mistakes. I'm sorry, you're not doing any mistakes or making any mistakes. Are you ready? I bet you are. Okay, so the first sentence is, I am going to give you a prescription for some medicine to help you get a better night's sleep. Just taking your names down, guys. So, Kundan, can you please start?
Yes. What you said was, I'm going to give you a prescription to help you get a better night's sleep.
Thank you. Diego. Diego, what was the sentence?
Yes. Yeah, I am going to give you a prescription for medication for a better night's sleep.
Thank you. Dash.
I'm going to give you prescription for medication that you for better night's sleep.
Okay. John say.
Okay, thank you. I'm going to give you prescription to medicine to help you get better night's sleep.
Okay. Jensen? Gensler, I'm sorry. It's G, not G, right? Gessner. Oh, it's Gessner. Sorry, my dear. Gessner,
Yes,
please.
I'm going to prescribe you a medicine to sleep better at night.
Okay, so Gessner, thank you so much, except that you did a paraphrasing of the sentence. So we don't do that. We don't paraphrase. We just give the sentence as it is. I am going to prescribe you a medicine for a better night's sleep or to help you get a better night's sleep. This is the way he said it, and this is the way that we are going to do the interpretation.
Okay.
But we don't paraphrase. Thank you so much. Fran?
Okay. I'm going to give you prescriptions for medication to help you have a better night's sleep.
I'm sorry, dear. I didn't really quite hear you very well. Can you please repeat the sentence?
Okay, so I'm going to give you a prescription for medication to help you have a better night's sleep.
I am going to give you a prescription, right? Did that what you said?
Yeah, yeah.
Okay, great. Thank you. Ralph? Ralph?
Okay, do you hear me?
Yes, dear. Please go
Yeah.
ahead.
Okay, I'm going to prescribe you a medication to have a better night's sleep.
Thank you. Judy? Judy. It seems like Judy is having a problem with her mic.
Do you
Oh,
hear
here
me?
you are. Yep, okay.
Okay. I'm going to give you a prescription for medication to have a better night's sleep.
Great, amazing. Pragna?
I'm going to give a prescription to help you get a better night's sleep.
Thank you. Behnaz?
Yeah, Behnaz. I'm going to give you prescription meditation to get a better night's sleep.
To give you a prescription for what?
Better. Yeah.
I'm sorry, can you please repeat the sentence? The whole sentence.
Yeah, I'm going to give you prescription to help you get a better night's sleep.
Okay, acceptable. Friends?
Can
Friends?
you hear me, guys? Can you hear me?
Oh, yes, I can hear you.
Yeah, I'm gonna prescribe you a prescription for medication to have a better night's sleep.
Okay. Noha?
Yes, I'm going to prescribe a medication for better night's sleep.
Thank you. Who else? Who else, guys, didn't try? Sorry, maybe I just.
Me, Peterson.
Yeah,
Peterson, okay. Peterson and Stevens. Okay.
Stevens.
Okay. Peterson first.
Okay, you say hi. I'm going to give you some prescriptions for medications to help you get a better night's sleep.
Okay. Stevens.
Can you hear me?
Yes, dear. Please go ahead.
Yeah, I am going to give you a prescription for medication to help you get a better night's sleep.
Amazing. Here is the second sentence, guys. Here, you can get this prescription at any pharmacy. Just take one pill about 30 minutes before you go to bed. Friends?
Sorry, can you say again? It's a problem of connecting, so I can hear you clearly.
Okay, so dear, unfortunately, during the training, I'm not planning to give you any repetitions because I'm like training you guys to make sure that you get the sentence from the first time, unless you have any audio issues and you can ask for repetitions in your real calls. But if I'm going to give any repetitions in the training, this will be in the end, but not while we're like practicing. Okay.
Yeah, yeah.
So I do really apologize, my dear, if you're having any connection issues.
Oh, okay, thank you.
Thank you, dear. So, friends, please go ahead. Friends, can you hear me? Okay, Behnaz, go ahead, my dear.
I think what's bad is when you can get this prescription from any pharmacy and use it before to sleep.
You have a lot of omissions. You have well, you actually omitted the most important part in this sentence, unfortunately,
Actually,
which is
catch your voice perfectly because of the I don't know what's that.
Oh, okay. So who else had problem hearing the whole sentence? Who else had like a connection issue or an audio issue?
I don't. Can I try?
Okay, please go ahead.
You said, here you can take this prescription to any pharmacy before you go to bed.
Yeah, unfortunately, it's omitting like a lot of information.
Oh,
So
okay,
I
ma'am.
guess you guys didn't really get the sentence.
Okay, ma'am. Can I go
Okay, can
now,
I try? Can I try?
ma'am?
Okay, okay, hold on. I'm sorry. You're just like you're talking at the same time, all of you right now.
I'm sorry, ma'am.
Can I try?
Okay, okay. So keep raising your hands. I will pick your name. Okay? Peterson, go ahead.
Okay, ma'am. I'm sorry. Can you hear me?
Yes, I can. Please go ahead.
Okay, ma'am. You said here you can get this prescription in any pharmacy. Just take one before you go to bed.
Okay, acceptable. Thank you. Diego.
Yeah, you can get this prescription from any pharmacy. You're going to have one pill 30 minutes before you go to bed.
Amazing. Thank you. Who else? June say.
Thank you. Here, you can get this medicine at any pharmacy and take it before 30 minutes. Sorry, take it 30 minutes before you go to bed.
You have one omission. I'll let you know in the end. Stevens.
Okay. Here you can get the medicine at any pharmacy. Just take one pill 30 minutes before getting to bed.
Thank you. Diego, please stop writing down things on the chat. You're guys, we're not... Okay, thank you for helping the others, but we're practicing now. Okay. Thank you, Steven. Who else? Who else? Dash, I'm sorry. Is it Dash or Douche? Douche. Dash.
All right, no problem. Here you can take the prescription and take it to any pharmacy. Take one pill 30 minutes before going to bed.
Thank you. Who else? Judy. Judy. Agnes.
Hello, can
Here
you hear
is
me?
your
Yes, Judy. After pregnant, please.
Here is your prescription. You can get it at any pharmacy. Just take a one pill 30 minutes before you go to bed.
Okay, thank you. Judy, go ahead.
Can you hear me?
Yep, please go ahead.
Okay. Here the prescription. You can get it in any pharmacy. Just take one 30 minutes before going to bed.
Okay, thank you. Who else? Rol and Reina. Rima. Rolf and Rima. And Kundan.
Okay, do you hear me?
Yep.
Okay, you can get this prescription from any pharmacy. Take a pill 30 minutes before you go to bed.
Thank you. Rima. Rima. Okay, Kundan.
What you said is here, you can get this prescription from any pharmacy. Just take one pill before 30 minutes before you go to bed.
Okay. Nuha.
Yes, you can get this prescription from any pharmacy. You need to take one pill 30 minutes before go to the bed.
Okay, thank you. Rima. You're the last one. Rima? Okay, Rima is having a problem. Okay. Last sentence, guys, and I'm going to like let you go in peace. The prescription is for 30 days. If you're not sleeping well after 30 days, I'd like you to come back in. And don't worry about work. It's not gonna make you sleep at work. Guys, try as much as you can to be quick in unmuting yourself. Friends first. Friends?
Hi. Uh, for the prescriptions is contained for 24 days. If you're not sleeping well in 3 days, please come back and do not throw it back. It can make you sleep worse.
Oh no. This is not what the doctor said. Unfortunately, this is not correct, my dear. So, Bragna.
This prescription is for 30 days. After 30 days, if you do not feel better, come back. Don't worry. It will not make you sleep at work.
Acceptable. Thank you. Judy.
Okay, can you hear me?
Yep.
Okay, this prescription is for 30 days. If you're not feeling or if you're not sleep well, so come back, goes. Oh, I missed it.
Yep. Okay. Hard look. Next time.
Can I try?
Okay. Sure, Diego, go ahead.
This is France.
Oh, who's? Oh, I'm sorry, friends. Go ahead. Sorry,
Sure,
my
because earlier I was having
Enjoy.
trouble just to get the sound. Um, the prescription is for 30 days. If you are not sleeping well after 30 days, I'd like you to come back in work. It's not gonna make you sleep at work.
The last sentence is okay. Well, that's acceptable, but the last sentence is not very accurate. But it's acceptable. Thank you. Diego.
Yes. So the prescription is for 30 days. Please, if you're not sleeping better after 3 days, you can come back. And don't worry about your work. It's not going to make you sleep at work.
Thank you. Rema.
The subscription is for 30 days. Don't worry about the effects. It will not make you sleep during your work hours.
Oh, Rema. This is not correct, unfortunately, and he's not talking about the subscription. He's talking about the description. I'm sorry, the prescription. Okay, it's about the prescription, not the subscription.
Oh, yeah.
Um,
Yeah.
okay. And guys, please, again, if anyone is having captions on, unfortunately, it's not gonna help you in polishing your skills because even in your normal calls, if you have captions on, it's going to mislead you a lot because clients they speak English, but they are not native English. Yeah, like they're not native English speakers. Most of the English speakers that you're going to have over the phone are not actually natives. They could be from Asia, they could be from India, they could be from even like an Arabs, and they do speak with an accent. So if you have captions on, it's going to mislead you a lot. You have to again rely on your skills, work on your skills, polish your skills, develop yourself better than relying on captions because, again, captions are not working. Captions are misleading. You might say something and it hears something else. So it's not accurate. Again, what we're doing here, we are training ourselves, we're practicing the on working on the skills that we need to work as and to succeed as interpreters. Nudli, Noodly, it seems like you're having a connection issue. You keep like leaving and coming back, and I know that you missed a very important part and a big part of today's session. You can just watch the recordings. We have like multiple recordings for this session. I don't know why. Like sometimes it just stopped recording. Some people try to record, and I also tried as much as I can to record as soon as it starts. So whatever the part that you missed, please go back to the recording, watch it again, and I'll be waiting for you tomorrow. Okay?
Can I try, ma'am?
Who's this? I'm sorry.
Peterson.
Okay, please go ahead.
I think that you say the prescription is for 30 days. If you're not sleeping well after 30 days, I'd like you to come back in and don't worry about work. It's not gonna make you not work, isn't it?
The last sentence is not accurate. It's not gonna make you sleep at work. But thank
Oh,
you
I'm
so much.
sorry. Okay.
Great. Gessner, go ahead.
This prescription is for 30 days. If you're not sleeping well after 30 days, um, it's not gonna make you sleep at work.
Okay. Well, you were breaking up in the last sentence, but I guess you got it right.
Okay, thank you.
Great. Guys, whoever again is having any connection issue, any audio issue, any headset issue, please fix your issues because unfortunately there are some requirements, some technical requirements that you have to be able to work as an interpreter, to be acceptable, to pass in the test. Okay? So connection is very important, your headset is very important, your PC has to be working properly with proper Windows. At least if you're using Windows, not Mac, at least Windows 10, not least than this. Okay? Who else? Who wants to try with this sentence? Dash.
I wanna try.
The prescription is for 30 days. If you don't sleep well for 30 days, you can come back in, and don't worry, it will not make you sleep at work.
Acceptable. Thank you. Stevens.
The prescription is for 30 days. If you are not sleeping well after 2 days, at least it's a comeback. Don't worry, it will make you sleep well.
It will make you sleep well?
Well, yeah.
Yep. This is not correct, unfortunately. The last sentence wasn't like this.
Okay.
I'll let you know in the end.
Let me try.
Don't say, who's this? Who's this? Judy. Okay, go ahead.
Okay.
Judy, you actually did, sorry.
Yeah.
Okay, thank you. Let's
This
hear someone else.
prescription is for 30 days. If you're not sleeping well after 3 days, please come back to see me. Don't worry about work. It will not make you sleep at work.
Okay, but actually it's not 3 days, my dear. Let you know in the end. Behnaz?
Oh, I thought.
Yeah, this prescription is for 30 days. If you're not sleeping well after 30 days, I would like you to come back. Don't worry about your work. This won't make you sleep at work.
Great, amazing. Thank you. Rolf? Rolf and Kundan and Rima?
Okay, do you hear me?
Yep, I can hear you. Please go
Okay,
ahead.
this prescription is for 30 days. If you do not sleep well after 30 days, just come back. You won't sleep at work.
Just come back, and the last sentence, you don't sleep at work. You don't sleep at work? No,
You won't sleep. You won't sleep at work.
You
will
won't
not
sleep
sleep at work.
Okay. Okay. Acceptable. Okay. Thank you. Rema and Kundan and who else? Jonesy. Rema?
Okay,
Kundan?
yeah.
Okay, go ahead, my dear. Yes.
Okay, thank you. The prescription is for 30 days. If it doesn't help you get better sleep after 30 days, come back. Don't worry, it will not make you sleep at work.
Thank you. Kundan?
The prescription is for 30 days. If you cannot sleep well after 30 days, come back. If you're worried about work, don't worry. It will not make you sleep at work.
Thank you, except that you have one addition, which is if you worry about work, don't worry. He didn't say if you worry about work. So guys, again, make sure that you are sticking to the original utterance. This is the magical phrase, if you remember, from the protocol, the magical phrases, stick to the original utterance. If you stick to the original utterance, you're not gonna have any additions or omissions or misinterpretation in your renditions. Thank you.
Okay.
Rima, you are the last again. Are you with us? Seems like
Yes.
Rima. Oh, Rima, please go ahead.
Yes, the prescription is for 30 days. If you take the prescription after 30 days, you don't see if it makes you doesn't sleep at night, you can come back to me after 30 days, but don't worry about when you're at work. The effect will not make you sleep during work time.
Junior, this is a very long rendition for just 3 sentences. Kind of sentence or speech. You have made paraphrasing, which is not correct, and you have additions. And you have one misinterpretation, by the way. Can you please start over, try with this sentence again?
The sentence, the prescription is for 30 days. Don't worry about the effects at work. It will not make you sleepy.
Nope. Nope. Unfortunately, this is not correct, my dear. Noha, I'm sorry I forgot about you. Noha, can you please go ahead?
Yeah, sure. This prescription for 30 days. If you don't sleep well after 30 days, you can come back. Don't worry, it will not make you sleep at work.
Great, amazing. So that was the sentence.
Oh, that.
Yep.
Oh,
So you can compare what you have, what you said, to the sentence. Thank you, all of you. This is the end of today's session. Thank you, all of you, for attending until the end, for actually attending for more than like 2 hours. We usually, like, the coming sessions should not take more than 2 hours. It should take from 1 to 2 hours, something like that. It shouldn't take any longer, but today, because we did like a very quick summary of the protocol, and we we had a lot of questions, so we took more than the 2 hours of our sessions. I remember someone left a question about how long sessions take and for how long we're going to stay in the training. How long sessions take? They take any time between 1 hour to 2 hours. Okay? And what we're going to do in the upcoming sessions, we're going to practice more. What we just did right now, this practice, this exercise that we just had, we're going to do it more and more with more sentences, with longer sentences and more lists. We're going to give you sentences that are kind of close to real conversations or real sentences that could be given in a real conversation between a doctor and a patient. So I want you
I
to
enjoyed this
please.
exercise.
I'm sorry, who's this?
It's Peterson. I said that I enjoyed this
Oh,
exercise.
great. Thank you so much. Okay, so guys, just please wait until I finish. Just
Excuse me.
wait, please.
Norhan, yes, I
Yeah.
wanted to ask you something. Are we going to start using the terminology and the
We are
acronym?
going to do that, of course. Of course, guys. Well, the next sentence, the sentences that we'll be using in the coming sessions are actually more intense than what we just did. We were just warming up with these 3 sentences that I just gave you. So that's why I want you to please be prepared with the medical terms and acronyms, because all of the coming sessions will be using the terms and acronyms that you are supposed to be memorizing now, and you are supposed to have knowledge of, because you can't, or you actually wouldn't ever be a medical interpreter without having the medical knowledge. It's not going to work. And that's why you have to please spend a lot of time memorizing the medical terms and acronyms, do your own research, look up any medical term that you don't have any idea about or you don't have the equivalent for, look it up, go to Google images, look up human body anatomy, like have a visual representation of where the organs are, what could happen to this organ if it's wounded, whatever. Just do your own kind of work, your individual work. What we're doing here in the training is that we just put you at the beginning of this road, but walking down this road is your own responsibility. Okay, I can't like hold your hands and walk the road with you. It's your own responsibility. So please spend time on memorizing the medical terms and acronyms. Gain the knowledge. If you don't have medical knowledge, any previous or background information in this field, please start doing that. It is very important. Again, clients and LEPs, they expect you guys to be knowledgeable, to be actually to have the knowledge, to have the medical knowledge, because we call you medical specialized interpreters. And that's why we are preparing you to be a medical specialized interpreter. So you will be specialized in the medical field. You might receive some other calls from different fields, but mainly you're going to receive medical calls, and you will not be able to handle these calls without having the medical knowledge. Okay, so number one, focus on memorizing medical terms and acronyms. Number two, you have to memorize the scripts in the protocol, how to say the introduction to the client, how to say the introduction to the LEP, how to interfere in case you need any repetitions or clarifications or whatever, and how to say the closing and how to do the closing properly. The last thing is I'm going to send you two videos. The first video is like, it is relatively long. It is 1 hour long, I guess. It will help you so much, guys, with the note-taking skills. It is called the power of selectivity, I guess, the power of selectivity. So it's going to help you how to select the keywords in any speech. It is 1 hour long, but it's very, very, very beneficial. It's going to help you so much with the note-taking. I'm also going to send you another video to practice with. If you have enough time after you memorize the medical terms and acronyms, or the portion that you put for yourself, a daily portion to finish all the medical terms and acronyms, if you finish that, if you have still time to practice, please watch the video. It is a conversation between a doctor and a patient, a diabetic patient. They're going to talk about what's happening with diabetes and how to check the blood sugar and all that stuff. So you can practice with that. It gives you time to do your rendition after the speaker stops. You can check it out. If you don't have time, at least watch the video. Just get a normal kind of background information or knowledge about how it goes and how a conversation should or could go between a patient and a doctor. You might have like on the suggestion bar on the left or the right on YouTube, it might give you like more other videos like the video that I'm going to give you, so you can practice more with more conversations and diverse conversations could happen between a doctor and a patient. So again, today I will send you again all the material that I have, called protocols, for those who didn't like download it or had any problem finding it. I'm going to send it all at once again for all of you, and the two videos, and I'm going to send you some medical terms and acronyms to focus on. This is for our test, okay?
Yeah, I was about to ask you about that, Norhan. I'm sorry. Do we have to look at the first 10 acronyms and first 20 medical terms, or maybe the ones you are going to give us?
Well, I'm going to select some medical terms and acronyms, okay? And I will post it here for you guys to focus on. This means, or this actually doesn't mean that you should only work on those and forget about the terminologies that we have on the sheet, okay? What we're going to do is we're actually going to work on the medical terms and acronyms on the sheet by default, and then focus on the terms and the terms that I'm going to send here on the chat.
All right.
Secondary.
All right, the most common ones, and we still have to check all of them out, right?
Exactly. Guys, what is included in this sheet or like the most commonly used medical terms and acronyms. Most commonly used doesn't mean that this is all of the medical terms that a doctor could use in their conversation with a patient. Which means if those are the most commonly used, this means that I should actually memorize those as if I know my name by heart. Okay? So those are not all the medical terms, but those are the most commonly used. So I have to know those by heart. Okay? So by default, you should be working on memorizing all the medical terms and acronyms that is included in the sheet that I sent you, while focusing on what I'm going to send you here on the chat. Okay?
All right.
That's okay.
Amazing.
More
And
question and
in
then
my test, what I'm
Sure,
going
ma'am.
to test you on, I'm going to test you on the medical terms and acronyms that I'm sending here, the ones that you should focus on. Those what I'm going to test you on. Okay?
Wonderful. Thank you,
Great.
Nahan.
Thank
Great
you.
job.
Is it all clear? Do you still have any questions?
I have one more question. Is the
Sure.
number of memorizing the medical terminology is important? For example, daily, how many terms should we memorize?
It's up to you. If you up to your capacity. If you can work on 100 medical terms every day, then you're going to finish it in 3 days. If you can work on more or less, it's up to you. You can plan it for yourself according to your capacity, according to your time, if you have time actually or not. Depends on
Yeah,
each and every one. Yeah.
thank you.
But again, by the end of this week, you should have memorized all of them by the end of this week, because as we go, we'll be practicing, we'll be testing you on those, and we'll be like sending feedbacks about each and every one of you. We shouldn't take more than 1 week in the training unless you are having problem with the practicing part. Then you will stay in the training until you fix this problem. But normally, please try as much as you can not to take more than 1 week in the training phase, so that we can like expedite the process of doing an internal assessment for you, and then from the internal assessment we send you to the client to do their own final assessment, so you can start working as soon as possible. So the more you like the more time you take in actually working on the skills that you are that you need to work as an interpreter, and working on your knowledge as a medical specialized interpreter, the more you take in this, the more you're going to stay in the training. And we don't want that to happen, to be honest with you. We and you, of course, you want to start working immediately, right? So help us to
Absolutely.
help you.
Thank you.
Thank you.
I'm
Great.
sorry, man. What did you say?
I was just saying, please help us so that we can help you. Help us with memorizing the medical terms and acronyms as soon as possible. By the end of this week, try to finish them all. Help us with practicing and polishing your skills so that I can send a feedback about Gessner, that Gessner is doing amazing. Gessner's knowledge is amazing. So please, you can have him or you can do the internal assessment. If you pass the internal assessment with us first, we are going to send you to the client, and they are going to do a final assessment to you. If you pass the assessment with the client, you're going to start immediately as soon as they give you the schedule.
That makes a lot of sense.
Yep. Okay. Any more questions, guys?
No, I wanted to ask you something real quick. Is it common for the companies to ask us to use a camera, because my camera is on my phone, and
The video calls are not like, not all the platforms or the companies are actually receiving video calls, but well, some platforms they do receive video calls, and if you, unfortunately, if you got assigned to a platform or to a specific client who actually receives video calls, you will be required to have a good camera.
all right. So that would be, each of the cases. I mean, it can be that the company doesn't do video calls at all, and in that case, I don't need the camera. But it can also be that the company actually does video calls regularly, and I do need a camera. So those are the two
Yes,
options.
exactly. It depends on the platform itself that you will be assigned to. If you got assigned to a platform that receives video and audio calls, you will be required to have a video, because by default you will receive video calls as well. But if it's a platform that doesn't support video calls and it's only audio calls, then there is no need for a camera because you're not going to receive any video calls.
Okay, okay, thank you. That's good to know. I will get ready just in case.
Yeah, just in case. Any more questions?
Yeah, one question. For example, I have a laptop and I have an iPhone. If, for example, I'm started working and then I receive a phone call and I will receive a phone call, whatever video call, I can mute my camera. Can I take it on my iPhone? Should I use always a laptop?
Yeah, it's gonna always be on your PC. We don't use any phones in taking calls. And actually, while you are in a call, you are required to please avoid any distractions. Make sure that your phone is not with you, maybe, or on silent, whatever. Make sure that you're not distracted by anything while you are in a call, because again, this is not going to help you with the interpretation. As soon as you finish the call, you can just check your phone, or you can put yourself on a break, or you can do whatever, log out, whatever. But while you are in a call, it's always recommended to stay away from any distraction whatsoever. And we're not
Okay.
gonna use our phones. Okay? Okay, so
Yeah.
great. Thank you so much again, all of you, for staying until the end of the session. If you have any further questions, just leave it on the chat here. And as soon as possible, as soon as I can, I will respond or answer your questions. See you tomorrow at the same time, 12 p.m. EST. Tomorrow again, I will test you in the protocol, medical terms and acronyms that I'm going to send you to focus on today. And we're going to do practicing more than what you did today, with more comprehensive kind of sentences. So please be prepared for that. See you tomorrow at the same time. Thank you, all of you. Have a lovely rest of your day. Bye bye.
Thank you, ma'am. Bye bye.
You